Hi, my name is Emily and I'm a nursing student. I will be presenting my patient to you. The patient is a 65-year-old male, single and has never been married and has no children. Currently, he is living with his ill mother whom he takes care of. He is currently retired with a broad range of previous jobs in banking, finance, and social work. Most recently, he owned his own company. The patient is 5'6" and weighs 217 pounds. His blood pressure was 150/70, his heart rate was 40, and his respirations were 12. His reason for seeking care was removal of thyroid glands. The patient's history of present illness. He had complications from the surgery of the removal of thyroid gland, which has now kept him in the hospital 12 days post-operation due to increased fluid buildup. The patient was on a feeding tube for 5 days after his operation, which has now been removed, and he's on an all-liquid diet. The patient started having sore throats in November of 2012, which did not react to antibiotics. He then found a growth, or the doctors found a growth, on his right tonsil, which was removed and biopsied in early March. The patient has had cancer removed from his tonsils and now his thyroid. Spots of cancer were found on his lungs, and he was diagnosed with stage 4 lymphoma in mid-March. The patient began radiation therapy in late March. The patient states having had difficulty breathing, neck pains, muscle spasms, and an increased sputum since the onset of cancer in November. The patient was once an avid runner, but now reports a drop in his exercise routine due to the difficulty in breathing. Complications from the surgery had increased his difficulties in breathing. The patient has an inhaler that he reports that he does not use it often. The patient does find that running in the cold or walking in the cold will help open his airways, yet he often does not feel like exercising anymore, as mentioned before. The patient also reports having some anxiety and depression with his cancer diagnosis. The patient also reports having recent episodes of forgetfulness and reports not being himself. He is extremely anxious and worried about his health and is also unhappy with his recent weight gain and the diet he has been placed on. The patient also reports having no serious illnesses in the past, no known allergies, but states he might have an allergy to morphine and Demerol due to reactions he had after his surgery. His recent hospitalizations include the removal of his tonsils in mid-March. The patient is on various pain medications, including morphine and oxycodone, as well as muscle relaxers and anti-nausea medications. He has a healthy diet, and exercise was once a daily part of his routine, but since his cancer diagnosis, he no longer exercises. He reports drinking high amounts of caffeine throughout the day, but is not a drinker and does not smoke. The patient reports that he is not very spiritual, though he was raised Catholic. He does not have a wife or any children, as mentioned before, but he is very close with a sister who helps him take care of his mother. His family history is not extensive. His mother's only known ailment was asthma, and his father died of bladder cancer. So a review of systems for the respiratory assessment. The patient has no history of COPD, congestive heart failure, or emphysema. The patient reports having asthma since his teenage years, for which he has an inhaler that he does not often use. The patient has a slight cough with clear sputum, which is alleviated by sitting up. The patient reports having labored breathing, which is visible to the eye. The patient reports having exercise intolerance, which is due to shortness of breath on exertion and lack of motivation. A review of systems for the abdominal assessment. The patient reports having no intensive abdominal pain, though he does have some discomfort since surgery, which he feels is due to the change in his diet. He has difficulty swallowing since his throat surgery, and he also reports no diarrhea, gas, or pain during bowel movements. His stool is a normal color. The patient reports having nausea and vomiting since the surgery, which he attributes to the pain medication. The patient also states having initial weight gain when he learned of his cancer diagnosis, which he felt was due to stress, yet has recently lost around 2 pounds since being hospitalized. On the physical examination of the respiratory assessment, I found on inspection no cyanosis, although I did find that his breathing was deep and labored. His AP to transverse diameter was 1 to 2. His chest expansion was even on both sides, and I noticed the drainage tube just superior to the clavicle, which was draining small amounts of clear fluid. Upon palpation, I found chest expansion to be even on both sides and no crepitus. There was some increase of tactile fremitus in the lower lobes of both lungs. When auscultating, I found normal bronchial breath sounds along the trachea and vesicular lung sounds throughout the lungs. After performing bronchophony, agnophony, and whispered pectoriloquy, I found that there was increased sounds in the lower lung fields. On physical examination of the abdominal, I found his stomach was convex, his skin color was normal, his hair distribution was normal, there was no surface movement, and no scars or lesions. There were increased abdominal noises in all 4 quadrants and no bruits. Upon palpation, I did not feel any abnormalities, and the patient had no mention of pain. After performing the obturator ilioscopus, subcutaneous hypersensitivity, and rebound tenderness, there was no pain found due to peritoneal irritation. The patient received a 15 on the mini nutritional assessment. Another assessment which would be affected due to the patient's lymphoma would be the cardiac system. According to the Journal of American Medical Association, patients surviving lymphoma who have undergone radiation therapy may show signs of valvular dysfunction as well as carotid subclavian and coronary artery disease. As my patient continues to undergo radiation therapy, it will be increasingly important to perform the cardiac assessment to check for any abnormalities. Another system which would be important to assess for my patient would be the neurological assessment, as he reported having recent episodes of forgetfulness and personality changes. According to the National Cancer Institute, radiation therapy could be the cause of my patient's forgetfulness, and because he has lymphoma and his body's immune system is already altered, these effects may be heightened.